So this is the posterior horn of the medial meniscus. A little bit of chondromalacia here, very little. That's nothing major. Just get some of this frayed tissue out of the way. The deep MCL just gave way, which is actually nice. I would have done that myself, which I sometimes do on purpose. So here's a little scuffing of the meniscus, but just a little superficial tear on the superior surface. But there's the major tear in the back. So that looks to me like that's a repairable tear. So I can put some stitches across that and repair this. Okay, so the first thing I do for a meniscus that's repairable is I start to clean it up with no suction on. I don't want to pull any of that, as little tissue into the shaver as I can so that I'm not damaging that tissue. And I want to create a bleeding response by irritating the capsule back here and on top. And then that'll give us the best chance of getting this to heal. Meniscus tears, they have a failure rate, and there's a poor blood supply to the meniscus. So some of them do fail. They do heal better done in conjunction with an ACL, probably because we're drilling tunnels in the bone, which creates a nice blood supply into the, or at least some bone marrow and some stem cells, and all the growth factors coming from the bones leaking into the joint help the healing process.
What are you doing right now?
Tensioning it. So we've got that 2 stitches through that lateral meniscus is now repaired, so it's no longer pulling into the joint.